So, you think your child has asthma. Now, how do you diagnose it and what will you do for treatment? That's what this video is all about. So stay tuned. Hello everyone, I'm Dr. Eileen. I'm a board certified pediatrician, and on this channel, I go over some of the most commonly discussed topics in pediatrics so that you can feel more empowered as parents and understand more fully some of the common conditions we see in pediatrics and know the signs and symptoms and situations when you would want to bring your child in to see the pediatrician. So in this video, I'm going to talk about the diagnosis and treatment of asthma. Asthma is such a big topic in pediatrics, so in order to help you digest and break it down, I split this into several videos on asthma. So if you haven't checked out my other videos on asthma, please be sure to check them out so that what we're covering in this video will hopefully make more sense to you. So you think your child has asthma, but the question is, now what do you do as a parent and how do you treat it? Now remember guys, this video is not meant to make the diagnosis of asthma for you, but to help you understand the whole process, how pediatricians like myself determine and diagnose asthma in children, and what I generally recommend in terms of treating asthma depending on the severity of the asthma in your child. So let's get started. So when you see your doctor for possible asthma, there might be several things that your doctor will ask of you. We'll be asking you symptoms of cough, of wheezing, of shortness of breath, of difficulty breathing, just to kind of assess what kind of symptoms and signs that your child is exhibiting. We'll often ask you how often they're experiencing it and also how often they have felt the need that they needed something additional like a medication to help them breathe. These are all part of the clinical assessment of asthma because most of the asthma can be diagnosed by clinical history. However, if your child is a little bit older, now I generally see it depending on the maturity of the child. Some can answer and do this diagnostic test for me when they're 5. Some a little bit older, especially if they're shy. In older children, I use the spirometry, which is a device that measures pulmonary function test. What this usually does is that it assesses the amount of air that your child can exhale and how quickly. What we ask your child to do is breathe into this device and tube as much and fast and forcefully as he can and measure how much air is actually coming out of his lungs and what time frame. This will help me assess the severity of the condition, if asthma is a condition that we should be concerned about, or if there is something else involved. So again, most asthmas are diagnosed clinically, usually by the clinical symptoms that the patient is already showing. And number 2, in older children who can cooperate with the test, we can do the spirometry pulmonary function test. We can get additional information to help us gauge and measure how severe asthma may be for your child. The treatment of asthma is based on how severe asthma is for your child. So to understand this, I want you to think of asthma as in 2 big categories. Children who have persistent asthma. So these are the kids who have asthma more days than not. They may have more than 2 days a week of showing you daytime symptoms of cough, or at least 2 nights a week of nighttime cough. Or they may be needing their rescue inhaler almost every single day, or they're coughing every time they're doing anything active or sports related. The other big category of asthma is more what I called intermittent or mild. Intermittent really just means that it comes and goes. So your child may go for 8 months a year with no symptoms, really no cough, no big deal. And then during the winter months, or sometimes whatever the triggers may be, they may be coughing a lot. You might hear them coughing most nights of the week during those short frame of time. But for the majority of the year, parents would tell me, oh, he doesn't cough at all unless it's in January. So those are 2 big categories, persistent and intermittent. So if your symptoms are mild or intermittent, most doctors will prescribe you with a quick relief inhaler. So those are what most people actually think of when they think of asthma inhalers. These are called the quick relief inhalers, or I call them rescue breath, because these are meant to deliver puffs of air and medication down your lungs that give you quick relief. It opens up your airways. They're called bronchodilators. So literally it opens up your airways and help you breathe. But the effect of this medication is generally very short-lived. So maybe 2 hours, maybe 4 hours at a time. It doesn't really prevent asthma attacks. It doesn't really prevent asthma from coming back or the symptoms from coming back. It just works as a quick relief medication. When you feel difficulty breathing, you're coughing or short of breath, you take 1 to 2 puffs of quick relief bronchodilators, and that will help you feel better by opening up your airways. So some of the common medications you may hear of this is your albuterol medication. Some generics out there may be ProAir, maybe Proventil. So there are many different kinds of medications out there that your doctor can prescribe you, but they're generally called a quick relief rescue inhaler for asthma. And by the way, if you found anything helpful in this segment so far, please give it a like and subscribe so that you can be notified for my new videos. It is important to know that a quick relief medication when you have asthma is not all you need, because oftentimes if your asthma becomes more active, like you're experiencing more cough, more shortness of breath, or more nighttime cough or wheezing, you may need more of a long-term control medication. Really, for me, long-term control medication for asthma is really where it's at, because these are the medications that reduces the inflammation in your airways. They really work internally to help your lungs heal so that you don't have so many asthma attacks or episodes where you have to use a quick relief medication. So I always recommend long-term control medication for anyone who has asthma in case their symptoms become more frequent. Now, there are several types of long-term control medications for asthma. The most common that we hear, we often use and prescribe, are called inhaled corticosteroids. So inhaled corticosteroids are long-term control medication for asthma because you inhale them sometimes for a few days up to a few weeks, depending on how active your asthma is. And what they do is they kind of modulate and help your lungs heal and reduce the inflammation that causes airway narrowing. So these are medications that are very important to use on patients who have more persistent asthma, because they definitely help to lower your risk of having more asthma attacks and help prevent some of those episodes. Some of the most common inhaled corticosteroids that we use are fluticasone, budesonide, mometasone, and so on. You might have heard the brand names like Asthmanex, Qvar, Pulmicort, Flovent, and so forth. So these, when your doctor gives you one of these, they're asking you to use it probably on a daily basis for a short term when your child's having daily symptoms or frequent symptoms of asthma, in order to control the asthma more so they're not having those constant episodes. Your doctor may also prescribe you another form of long-term control medication called combination inhalers. Combination inhalers are actually your inhaled corticosteroids, the ones that we had just mentioned before, plus a long-acting bronchodilator. So these medications are written for kids who have more symptoms, who have not had the best control with just an inhaled corticosteroid to help their symptoms like coughing and wheezing. Lastly, there are the Leukotriene modulators or modifiers. These are actually commonly used that can sometimes be used solely to control mild asthma, but when you have more persistent asthma, you need the Leukotriene modifiers plus something else like inhaled corticosteroid inhaler or the combination inhaler. But Leukotriene modifiers, one that I use frequently is called Montelukast, and recently the FDA has put a label warning to say there has been increased psychological behavioral issues when some children use this, so we need to make you aware of it. Having said that, I've used this many years. A lot of patients do well with it, and they do find that it helps with their allergic symptoms and also their asthmatic symptom. So that is something to consider, and your doctor may prescribe it for you if they think that your child will benefit from it. So there are other medications that go beyond what we have just mentioned, like immunomodulators. These are usually reserved for kids with very severe asthma, and if you really have very, very severe asthma, I do recommend seeing a lung specialist like the pulmonologist, so they can be monitored more closely for symptoms and for side effects of this medication. So we covered an array of treatments for asthma. For children with very mild asthma, I always recommend the short-acting quick relief medication, but with a long-term control medication on board in case they need it, or maybe just a leukotriene receptor modifier modulator like montelukast. For children who have more persistent asthma, it's very important to have a daily medication like a control medication like inhaled corticosteroid on hand, because when you use these medications as prescribed, your child will have less episodes of asthma attack, because these medications like the inhaled corticosteroid inhalers or the combination inhalers, they really work to improve the internal health of your lungs. They reduce the inflammation, they help your lungs heal faster. So all those can actually improve the state of the lungs for your child. It's very important to use those. And then also you need a quick relief medication just in case the asthma acts up. And then there's also combination therapies to consider if the asthma for some reason is not well controlled. Now, aside from the medication-centered treatment of asthma, I have to mention some important lifestyle treatment of asthma. If your child has mild asthma or some asthma at all, it's very important to stay active and stay in a healthy weight range for their body. That helps with asthma control. It's also very important to eat a balanced diet that is not just high in processed food, but real produce and real foods. And also it's very important for you as a family to recognize what kind of allergies they may have that might be contributing to the symptoms of asthma or what they're responding to. It's very important to know what your child's asthma triggers are. Are the triggers usually, seasonal, when the weather gets cold, when the weather changes? Is it because of certain allergens that your child may be exposed to at certain times of the year? It's very important to know these, because the more you know, the more you can anticipate when their asthma may be acting up. And there you have it, you guys, the diagnosis and treatment of childhood asthma. Now, the treatment of childhood asthma is really specific to the patient, from person to person, depending on their symptoms, their triggers. So this educational video is meant to kind of give you guys more understanding of what these treatments options are, but it's very important to go see your doctor so they can kind of point out what your child needs. And when you see your doctor, you should form an asthma action plan with your pediatrician. The asthma action plan helps each family understand what symptoms to look out for and helps you assess whether the treatment is actually working to control the asthma, and when there are times that need more adjustment or changes to the medication. It will also help your child understand what medications they need to use in certain times and for what reason. So these are all really important tools. I definitely want you to take the time and don't feel shy to bring this up with your pediatrician. They'll be happy to help you. I appreciate you guys so much for watching this. And if you have any questions or comments, please leave it below. I'll be happy to answer them for you. And stay tuned for the next video.